And use bandanas or scarves as a last resort.
Our usage increased by several hundredfold. We could see our equipment supply going down dramatically. So you kind of clamp down a little bit and say, you know, we're going to save it for these very specific encounters. So now from the perspective of a healthcare worker, you're taking away my safety. And what people really wanted was a big enough supply so that anyone who felt that they were at higher risk could be safe.
One mask to be worn for 12 hours. It's just ridiculous. No protective equipment, the gowns, we have to improvise with what we have.
We have people coming and sewing masks, sewing shields, making things out of plastics. This is what we're doing now. I mean, that would be like a soldier going to war and making a plastic gun to bring with him. This is what's happening.
사실 그 앵보를 처음 만든 나라는 미국인데 그게 물량이 부족했다는 게 너무 좀 안타깝고 슬펐습니다.
We're here in the community fighting every day, and we need some help.
In February, the Trump administration actually created the China COVID Procurement Service to encourage American producers like 3M to sell their entire inventories of N95 masks to China. When American hospitals desperately needed N95s, they were forced to import them and pay up to 10 times more than the price charged by American producers.
PPE has been sporadic, but we do what we have to do. We're nurses, and we learn to adapt and to get the job done and get the care provided, and that's what we're going to continue to do.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no, I agree, Mr. President.
Because
Absolutely.
I've heard the opposite. I've heard that they are loaded up with gowns now, and you know, initially we had nothing. We had empty cupboards, we had empty shelves, we had nothing, because it wasn't put there by the last administration.
In the midst of the crisis, President Trump goes on TV and says, don't worry, we've got plenty of PPE for healthcare workers. What was your reaction when you saw that?
I know what my reaction was. I turned to my wife and said, that's complete bullshit. He has no idea what he's talking about. I'm getting 500 to 1,000 emails a day. I'm getting emails from people, not businesses. I'm getting emails from moms. I'm getting emails from old people. Please, send me masks. And
you make a product that can protect people.
I can't help these. I can't help all these people.
The PPE shortage continued on for months, even after Trump put one of his most trusted family members in charge of procuring protective equipment.
Jared Kushner formed his own task force to get supplies. Was that confusing?
It was extremely confusing.
The president wanted to make sure that we had the best people doing the best jobs and making sure that we had the right people focused on all the things that needed to happen to make sure that we can deliver in these unusual times for the American people.
My old boss called me and said he heard that Jared Kushner's task force needed younger volunteers who had general skills and were willing to work 7 days a week for no money. And if you fit those criteria, that you should head to DC and help with the pandemic response. I definitely had some apprehension about working for the administration, but it felt like the country and the world were under attack. It seemed like if there was something to do to help, that was the right thing to do. They basically gave us a day to show up in DC at the FEMA headquarters. And we walked into conference room A, which was this windowless subterranean conference room. There were televisions all around the walls, all playing Fox News. One representative from FEMA and one representative from the military gave a quick pep talk. They kept saying the stuff, and by that they meant PPE. And they kept saying there's stuff all around the world, there's stuff in the US, and we need to get it to hospitals as fast as possible. Everyone stood up and started filing into different offices, and I remember the only people left were the volunteers. We thought we'd be auxiliary support for an existing procurement team that just needed to be expanded as quickly as possible, and we would do data entry for contracts. And instead, we were the team. I think when people imagined the federal government response in the war room, they thought it would be this big, energized group of experts, not 10, 20-year-old volunteers, all just with private laptops, no industry relationships, no experience working in supply chain. So we started cold emailing people we knew who had business relationships in China, looking for factories online, and emailing them from our personal Gmail accounts. Because we had never done this before, there were all these really basic questions about how a federal procurement operation should work. We would call factories and say, we think the federal government can send you a check in 60 days. And they would say, there's someone with a briefcase of cash, and they're offering to pay me right now. And we would run around the FEMA building looking for someone who could tell us what payment terms the federal government was allowed to offer, and no one ever told us. 1 week into our work, several government employees walked into the room and handed out NDAs and told us we had to sign the NDAs or leave the room immediately. And we all had built our own relationships with manufacturers, and it felt like if we walked away, it would negatively affect our ability to buy this critical life-saving equipment. And so we all begrudgingly signed the NDA. In the room, there were those TVs all around the walls playing the news. They always had a death counter. And so every hour we were sitting there trying to buy PPE that we all knew could save lives, and we were watching the number of deaths in the US tick higher and higher and higher. And that weighed on all of us.
The president also instructed me to make sure that I break down every barrier needed to make sure that the teams can succeed.
The first time Jared Kushner came into the room, he had this big entourage, and he said, I want to make this as effective as possible. Tell me the problems that you have, and I will solve them today. And we said, we need to be able to pay up front, and he said, done. But there was no action taken that we saw whatsoever. In the entire time that I was a volunteer, our team did not directly purchase a single mask.
Kushner failed to protect doctors and nurses, but he was willing to trade government help for political benefits. When the Democratic governor of California, Gavin Newsom, desperately needed testing swabs, Kushner said Trump would grant the request on 2 conditions. Newsom would have to get on the phone and ask Trump personally, and then thank him publicly.
I want to thank the president not only for being available for a phone call at a moment's notice, but being willing to directly commit to all of us in the state of California.
Built around personal relationships, Kushner's task force was run by his college roommate and Ivanka Trump's former assistant. Rather than rely on experienced public officials, the task force prioritized private tips in a spreadsheet called VIP Update, which included 2 Republican dentists and a Fox News personality.
The whole philosophy of the task force was that the government can't get things done, and they thought the private market could largely settle this issue. But it was only once they had tried and failed that they'd started to blame other people and say, actually, this was your job the whole time.
You have instances where in cities they're running out, but the state still has a stockpile. And the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use.
My understanding is the only reason the federal stockpile exists is to distribute it to states.
The people in charge on the task force said, talking about the president, love him or hate him, he's a marketing genius. He came up with a strategy to blame the states because the federal government hasn't been able to do this effectively.
Federal government has assets and abilities that no state can possibly mobilize. They have a global supply chain. They have a logistic capability through the Department of Defense and Department of Homeland Security to get stuff in and distribute it to places all over the country. President Trump flipped that on its head. Then there became this mad rush for each and every state to try and find equipment on their own.
Breaker 19, this here's a rubber duck. Mercy sakes alive, looks like we got us a convoy.
We continue to source and ship as much PPE as we can by whatever means necessary.
Arizona, noon on the 7th of June, when they hive all over the pass.
We had the governor of Massachusetts using a plane from the New England Patriots to bring equipment from China.
The equipment is now in the hands of the National Guard, who will deliver it to an undisclosed location.
We had the governor of Maryland using contacts of his wife's to bring equipment in from South Korea. It felt it important enough to guard that equipment when it landed in Maryland because he didn't want it confiscated by the federal government.
We're competing against every other state, every other country. Now we're even competing against the federal government.
It's like being on eBay with 50 other states bidding on a ventilator. You see the bid go up because California bid, Illinois bid, Florida bid, New York bids, California rebids. And then FEMA starts bidding. So FEMA is driving up the price. What?
I stand here as someone who has had confirmed orders for millions of pieces of gear evaporate in front of us. And I can't tell you how frustrating it is.
I got a feeling that if somebody has a chance to sell to you or has a chance to sell to me, I'm going to lose every one of those.
All right, Charlie, thank you very much. Well, we do like you going out, seeing what you can get, if you can get it faster. And price is always a component of that also. And maybe that's why you lost to the feds. I'll tell you, that's probably why. But
if the goal was to get PPE to the states, why would the federal government be driving up the price to outbid them? Or was driving up the price the whole point?
this morning, our first project, and we call it Airbridge. It's Airbridge, that's the name. And it was a flight that landed at JFK and contains nearly 2 million masks. This is the first of 50 flights, and that will probably increase substantially.
Project Airbridge was a plan to subsidize the efforts of private companies to buy and sell PPE. Max Kennedy's team would find the PPE and negotiate the lowest possible price. Private companies would then pay the bill. Then the federal government would pay to fly the PPE stateside from overseas.
And we had partnered with the 5 largest medical distributors. Once we shipped it to the United States, they would take over and sell directly to whoever they would like at whatever price they wanted.
Just to clarify, that explains why states say they're bidding like they're on eBay, because the supplies are going to the private sector, and then they have to go there to get the supplies.
That's normally how things work, right? So I'm not here to disrupt a supply chain.
The US government was handing a huge amount of business to these 5 companies that were chosen fairly arbitrarily. There were increasing concerns, I think, from competitors that these 5 companies were getting a hugely unfair advantage. And so I was asked on several different occasions explicitly to find a justification to have selected these companies months after they had been selected.
At least one of these companies, Cardinal, saw its PPE orders surge to 12 times the normal volume. Profit-making was also part of the pandemic pricing plan at Gilead, which manufactured the one drug, remdesivir, that was effective at treating COVID. The federal government owned patents on the drug and had paid for essential research, but the Trump administration permitted Gilead to charge more than $3,000 a patient for a treatment that cost less than $10 to manufacture.
I left in mid-April, and my takeaway was really that I still feel like I haven't worked for the government. We were so far outside of it. I mean, every single person we reported to up the chain of command was a political appointee. The number of FEMA employees I met, I could count on one hand, and they were fleeting interactions. It taught me about how this administration works, and I think it largely works, or it seemed to work in this case, outside of the government.
In the course of 3 years, there was a systematic dismantling of what expertise had been built and what framework had been built to respond to the very kind of global pandemic that we're dealing with. It's preventing the people who are there from doing the jobs that they've been hired to do.
Tell me a little bit about how chloroquine and hydroxychloroquine first came into your point of view?
You know,
How did this first come up?
I wish I'd never heard of chloroquine and hydroxychloroquine, honestly.
Elon Musk started the ball rolling with a tweet. Momentum for the drugs picked up steam over the next few days on Fox News, where their names were dropped 176 times.
Early evidence suggests that chloroquine,
hydroxychloroquine, those look very promising.
Then Trump started reading from the Fox script.
It is known as a malaria drug, and it's been around for a long time. And it's shown very encouraging, very, very encouraging early results.
I believe it was March 23rd. I got a call from Secretary Azar's chief counsel. The White House wanted us to move quickly on making this drug available.
At my direction, the federal government is working to help obtain large quantities of chloroquine.
I called my scientific team in BARDA, and they said, no way. There was no data to support that they had any benefit against the coronavirus. They pushed back, but Dr. Kadlec reiterated that directive to us and said, get on it, get it done. We came up with the option of an emergency use authorization. We could put boundaries in it, restrict the drug to only be used in people who were hospitalized, and I was proud of our team for coming up with that compromise that we thought would protect Americans.
Have you ever heard of a Dr. Zelenko?
Yes. He is a very mysterious presence that seemed to evolve in the context of this chloroquine story.
Hi.
Dr. Vladimir Zelenko became a right-wing folk hero, and the Trump team promoted him as an essential expert on the use of hydroxychloroquine as a magical remedy for COVID.
For the last almost 16 years, I've been a primary care doctor for a community of around 35,000 people. It's a village in the town of Monroe. It's similar to an urban environment in terms of how close people live with each other. So it's not surprising that the virus came, it started spreading. And I realized that, my God, I have a inferno. I have a real outbreak. I know all these people, they're like family to me. So it was personal. The whole world was focusing on building more respirators, more hospitals. And there was nothing being offered to primary care doctors. You know, we're frontline soldiers with no bullets, no weapons. So then you have to improvise.
Dr. Zelenko improvised what he thought was a magic bullet that contained his own unproven mashup of zinc, azithromycin, and hydroxychloroquine. But there was no reputable clinical trial that confirmed Zelenko's claims that early use of his cocktail could cure COVID.
I wasn't doing research. I was just treating patients. But I'm not stupid. I saw exactly what was happening. Patients stopped dying. I just found potentially one of the most important pieces of information in the history of information. I'm not a politician. I don't have any connections. So how else does a person who's unconnected reach the highest levels of government? It's called social media.
Hello, President Trump. My name is Dr. Vladimir Zelenko.
So I made a YouTube video addressed to the President of the United States. And the next day, his chief of staff, Mark Meadows, calls me. We had a conversation, and that started a process that eventually led me to the FDA commissioner, Stephen Hahn. It's not every day you get the commissioner of the FDA calling you on your cell phone.
According to the FDA, anecdotal reports suggest that these drugs may offer some benefit.
There was not a scientific reason to push either one of those drugs. The reason they were pushing them so hard was because the president was claiming that they were a miracle drug. Someone had given him this advice.
I happen to be taking it. I'm taking it, hydroxychloroquine. Right now, yeah.
Did you hear what he said afterwards? That, yeah, I received a letter
from a doctor the other day from Westchester, New York, around the area. He didn't want anything. He just said, sir, I have hundreds of patients, and I give them hydroxychloroquine.
So that was a letter I sent to the president.
But I thought it was a very well-crafted letter.